Hey everyone, it's Amy here, and today I'm going to be interviewing a really special guest who's going to talk to us about COVID-19. And he is a well-known doctor, pathologist, and scientist who has helped operate several major clinical labs and also develop and launch various tests for cancer patients, infectious disease patients, and other diseases that are used all around the world. And he also happens to be my dad, Michael Dugan. Hey, Dad.
Hi, Amy. Thank you very much for having me.
Thanks for joining us, Dad. First question for you is, why is it important that all of us stay home right now?
Well, that's a very important question. This is a disease that knows no boundaries. It's spread very rapidly all over the world, and the reason why we've all had to stay at home is to try to limit the rate of spread so that we don't overwhelm the healthcare facilities which are taking care of these patients that do get sick. Um, Not everybody gets sick, and probably a far smaller percentage than what we initially thought. But it's still a huge number when you think of all the people being infected so quickly because the virus is very contagious. That's caused really huge demands on our medical healthcare system, and we need to keep the rate of growth of the disease slowed down. So that's the major reason to stay at home, just keeping things manageable so that we can go back to work at some point in the near future. Um, Taking precautions to stay away from each other a little bit and wearing masks to prevent the spread of the disease as much as possible.
Got it. And based on all the data out there right now, how long do you think it's going to last?
Well, it's been several months that the disease has been around. They call it COVID-19 because it arose in 2019 in China, spread quickly to other nations, some of which took precautions very quickly, like in Japan or in South Korea, and they don't have a big problem right now. But it spread to other countries like Iran and to Italy and to Spain, where people were less prepared for it, and it just quickly became a major problem with a lot of deaths accruing very rapidly as cases grew exponentially in those more crowded cities and places like that. It then came to New York, and we have a big problem in New York and many other cities where it's spread in more crowded conditions, in particular on subways or buses and restaurants and theaters and so forth, that spread very quickly. And so um, right now we're in this sort of lockdown situation, staying at home so that we can try to limit the spread and get it under control. And at the meantime, just trying to the country's really ramping up production of protective equipment that we need, like masks and gowns and face masks. And we're getting more and more ventilators built by the hundreds of thousands of ventilators, millions and millions of masks, and millions and millions of diagnostic tests. But that takes time to get ramped up, and the staying at home has helped us so that we could build up that capacity. And as we build the capacity and we take the protective measures, then it's easier for us to go back to work, ensuring that we take those precautions to minimize the rate of growth, the spread and rate of growth of new cases, so that we can manage it better. And so it doesn't have a real clear ending in terms of time, but probably very likely. And in fact, you see it right now. Some companies and so forth, people are going back to work in a more limited capacity, and then as the number of cases drops off, they can go back more and more. Again, taking precautions like staying separated a little bit and wearing masks, and particularly for certain types of functions, they can probably go back relatively quickly in the next few weeks. So things like manufacturing, distribution, and so forth. And then later we might see the return of people being able to go back to schools or going to sporting events. Again, taking precautions because those have a higher risk of transmission because they're more crowded.
So, do you think it's going to be lasting for months, for years?
Well, a good question. It certainly will be here with us for months. It'll probably be here with us for years. The difference is that within a year, we should have the results of clinical trials back, which help us to determine which therapies are most effective. There's some very promising data out just this week on one of those that will help treat patients who do have the severe complications. And then there's several vaccines under development with very billions of dollars being spent to develop those vaccines, and the clinical trials that are used to prove they're effective will take many, many months, maybe until next year or the early part of the next year beyond that to even fully fully proven to be effective. But they will likely be able to get some vaccine to market by next year that can help get people immunized to prevent the risk to the major portion of the population. And in the time being, we can minimize our own risk by just taking precautions, staying further apart from people than we might otherwise, wearing a mask when we go out in public, trying to avoid mass gatherings where you're hugging and kissing everybody. Obviously, there's been some terrible examples of cases spread very quickly within nursing homes, within ships, within people attending a funeral, and that's terrible. So we try to just have to be more cautious to try to avoid those types of large gatherings, especially avoiding them unless we're wearing a mask or staying a little bit apart from each other. And I think if we do those things, we'll be able to return to work relatively quickly, and we'll be able to go about our lives, if not quite the way we were before, some semblance of what we were doing before in the near future. And that'll really help us out. We'll be able to get back to work. We'll be able to do what we've done in the past. We just have to take more precautions than we did in the past until such time as we really see a diminished number of cases and we see a large number of people who have recovered from the disease, which then gives some protection to a large portion of the population.
So it's really all dependent on the results of these tests that they're doing and how quickly they can find the vaccine or solutions.
Well, in the development of new therapies and vaccines, they do what are called clinical trials, and they do those in phases. The first phase is to determine the safety of the product, and the next phases are used to determine if it's effective, and sort of at what level of effectiveness. And then they do it on larger scale groups of people, so they can really prove that that's clinically useful. Keep in mind that it's harder to develop a vaccine because you're going to give something to people that don't have any symptoms or disease. You don't want to make them sick, right, with the vaccine. Conversely, with a therapy that you're using to treat people who are already sick, they're willing to give these therapies in sort of a compassionate use basis where there's no other existing therapy available. They might try a drug that's not been fully proven to be effective, but there have been promising results in individual patients that make it look like it's worth a try. So you see that right now with several therapies being used, including there's some antiviral agents that have been used that are showing some very promising results. And there's also some agents that have been used to temper the immune response that have been used in things like autoimmune diseases, other diseases like malaria. Those, they're trying to see if they might modify the immune response. And there's even some interest in looking at people who have been vaccinated for tuberculosis, because they appear to be less susceptible in countries where tuberculosis is more common. They received a vaccine called BCG. They appear to have less of a problem with the coronavirus than other countries that are more developed that did not give people BCG vaccines. It's very interesting how the immune system interacts with the virus, creating situations of higher and lower susceptibility depending on a variety of factors.
Wow, interesting. Well, I guess based on what the news is telling everyone right now and kind of that hysteria going around, how fearful should everyone really be?
Well, that's a good question. Early on, the growth of cases was very fast. It was just tremendous, and there was no immunity. Nobody had seen this virus before, so there was no inherent immunity within the population. That makes people very susceptible. And the early reports underreported the number of cases, and hence the death rate looked very high. Like it's the percentage of number of deaths over number of cases, it was a very high percentage, at least 3 or 4%, maybe 5 or 10% in some places. That was very alarming. That made people think, oh my God, if I got this, I got a chance of dying. That's maybe like, 1 in 30 or 1 in 20. I mean, that's a lot. That's clearly not the case now for a variety of reasons. One is that we've learned since then that there's a large number of people who are asymptomatic who have the disease. Maybe 9 out of 10 or more are completely asymptomatic and don't know it. And this was shown recently in a study that just came out a few days ago in the New England Journal of Medicine, where they tested all these people that were delivering babies coming into the hospital because they had one one woman delivered a baby who had symptoms. They tested her, and then another one who was positive and tested her, and they decided, okay, let's just test everybody. And what they found was that within a month or so, they had like more than 200 patients tested, 215 patients tested, and they found that a very high, much higher percentage of those were positive than they would have imagined. It was actually like close to like 15.5% were positive. And what was surprising was that most of those patients, 9 out of 10 of the patients who were positive for the test, were actually negative in the sense of symptoms. They didn't have any symptoms at all that would alert the healthcare workers that they were positive. And so they could be spreaders of the disease without having symptoms of the disease. And that's been the big concern. So I guess it gives you two things. It gives you the concern that the disease is all over the place and spreading rapidly, yes. But it also reassures you because now you know that there's a lot more cases that are asymptomatic or mild symptoms that people don't even know about. And so the death rate as a percentage of the total number of cases is much, much lower. And we've also been able to test so many more patients than we did before. So now the testing numbers are becoming really, really greatly accentuated. And that's further diminishing, further enlarging the denominator. Well, the deaths, are increasing, but they're increasing at a much lower rate than this total number of cases tested. So we get this smaller and smaller fraction of deaths, this huge number of cases, and you're going to see that the death rate is much less than 1% as we go forward, I believe. And in the people that are seriously ill, they're going to be better treated. So the deaths from the people who are seriously ill is going to also go down with time. And that's very encouraging.
That's great. Well, thank you, Dad. Out of everything that you've told us, what would you say is like the number one most important takeaway for everyone to kind of know right now?
Oh gosh, there's a lot of really important things coming out. I would say it's very important to take precautions, particularly wear a mask. I noticed, I live in Orange County, and the people in Orange County, there's a large number of them who are Vietnamese or who are Korean, who I noticed wearing masks weeks ago before most Americans were wearing masks, or most, go to a typical grocery store, Vons, or you go to a CVS or something. Very few people were wearing masks 3 weeks ago. Today, or back then, everybody in a Korean grocery store was wearing a mask, and they had masks. So they must have been more used to the idea of wearing masks. And I think they are. When you go over to Far East, you see pictures of people in Korea or Japan or China or Vietnam. They're all wearing masks, and their rate of spread has been greatly slowed. They really don't have a huge problem with this pandemic right now in many of those countries. In fact, even Wuhan, Wuhan, China, where the virus started, they opened up the city again. They're back to work. So that's tremendous news. That's very encouraging to us that if we do the same thing, we can go back to work. We can get started doing what we want to do again, which is, all the things, work and play, that we really, really miss, and we want to do it.
Cool. Thank you so much, Dad. That was really valuable. I really appreciate your time. And everyone, my dad's going to be posting a lot of updates about COVID-19, where there's real, signal in the market instead of all the noise that you hear out there on the news. So if you're interested in following, his website is drdugan.com, spelled out Dugan.com. So visit that if you're interested. And thanks so much for listening. And thanks, Dad, for your time today.
Thank you, Amy. Bye.
Bye.